I knew that I would not.
Welcome back. It is Wellness Wednesday today, and we are talking about the do's and don'ts regarding acne.
And joining us right now to discuss this issue is KMIR contributor Dr. Stuart Kaplan. Thank you for joining us.
Thank you for having me.
So, acne, sometimes we think about acne as people who are teenagers having it, but some of us who are adults still get acne. So how do we treat it?
Well, a couple of things. One, you hear it all the time. I have patients, I tell them over and over, don't pick. And it's an unconscious habit. You see a pimple, you gotta pop it. It's bubble wrap. The problem with that is that when you squeeze, as much pops out as gets pushed underneath into the skin, and you're actually causing more inflammation.
I'm in my 30s, and I'm starting to get acne along my chin line. I've never had this problem before. Is that my age?
A third of all women get acne into their 30s. And it is predominantly, exactly as you said, around the mouth, around the jaw. It's not the cystic acne on the forehead and back. That is hormonal acne, and there are a number of things that we could do. Using a 10% benzoyl peroxide is helpful, but what's also helpful is a medicine called spironolactone. It's a prescription oral medicine that works to fight the androgens that cause acne in women in their 30s, particularly that's related to acne that flares before periods. If you combine that with antibiotics, it works very well.
Are there any other products that you recommend that would be good for fighting acne?
For fighting acne, there are 3 steps. There's topical prescription products, there's oral medications such as doxycycline, antibiotics, as well as spironolactone. Lasers are very helpful, Accutane, and my patients, especially those in the movie industry, if they get a cyst or a pimple that's going to interfere with filming, they can actually come to my office. We can give a tiny injection of a localized hydrocortisone that will shrink the pimple in about a day. It's going to go down, it'll get less red, and it's not going to leave a scab or a scar.
It's good to know that there is some relief out there.
Well, because stress makes acne worse, and there's now evidence that diet also has an effect on acne as well.
Lack of sleep, too?
I don't know that lack of sleep, although really if you think about cortisol levels and things like that, it probably does affect acne as well.
Very interesting stuff. Dr. Kaplan, thank you so much for being here.